Well, just a couple closing comments. There's always questions that I get around the community about the competition that occurs in healthcare in our community. But I think sometimes we don't talk enough about the collaboration, of which there really is a significant amount, and you've heard a lot about that already. But when I look at that list of things, like the Community Health Assessment Program, as we once called it, where we all got together, Riverstone, St. Vincent, and Billings Clinic, and decided as we encountered patients who had needs they couldn't afford, we would have an organized plan to refer them into various agencies in our community. And this is old data, but a couple of years ago, my recollection is that over half the uninsured living in Yellowstone County were referred through that program into agencies of one kind or another, primary care, dental care, mental health needs, for help that they needed. We've gone on from that to do the medication assistance program, and to put that in perspective, again, if my memory serves me right, something like $400,000 to $500,000 a month of retail value pharmaceuticals are made available to people who don't otherwise have the ability to get on medications that they need. The dental program, which really is driven heavily here at Riverstone, but has been in some ways along the way a cooperative effort, a place in the community where people who would otherwise be unable to afford dental care can get it. The inpatient hospice facility that has just opened involved cooperation across the community, but certainly amongst our alliance members as well. The family practice residency, disaster preparedness in our community, which has come a long way in recent years. And so the amount of collaboration and the importance of it in terms of doing things that are really important in the community is really quite significant. In fact, in my experience and in my encounters in other communities around the country, it is somewhat rare to see this level of collaboration between public health, a community health center, and acute care institutions. And I think when it happens, the impact it can have over time on helping people who otherwise might not have needs met is very, very significant. And as you can tell, we intend to stay on this path because there's a lot of work to do. And then lastly, since I have the opportunity, you have seen the announcement that Will Anderson is planning retirement. And if there's a driver of all this, although it does involve many people, as you're hearing, across our community and many of this outstanding staff from all of our organizations, but the driver of this and the leader in many ways and the one who brought the passion around this together to really help us create this platform for collaboration has been Will Anderson, and we thank you for that, Will. Thanks for being here. We appreciate it very much, and I think some of us are around for questions if there are any.